Hello, everybody. A little bit of an awkward start to today's episode because I thought we had the theme ready to go, but we do not have the theme ready to go because I had to kind of like clear a lot of space out on the computer at the moment. So just to kind of because we were getting the disk clogged up with a bunch of things to the point where it was pretty much just making the computer impossible to use. So, yeah, that is what we are looking at this point in time. But yeah, just want to let you know, because we do have a lot of great stuff on the show today, because we're going to be talking about the latest with the coronavirus, including Dr. Anthony Fauci reassuring Congress that the U.S. will likely have a vaccine by the year's end or sometime in early 2021. Also, we're talking about some other news with the coronavirus, including House Democrats comparing the outbreak in the U.S. to lower caseloads in Europe and Asia, the deal that some of the biggest big pharma companies have struck with the government for a vaccine, and contact tracing in the U.S. is failing, undone by rising caseloads and lags in testing, and really not much so far to do with the White House and the Democrats and jobless aid. So, yeah, I do want to we'll be talking about that story as well, because literally, this is just, people do not understand, I think, from other countries, how just much of a joke our government is, both Democrats and Republicans, because with most of the country, like more than 50% of the country, set to lose their main source of income now overnight with these unemployment benefits set to expire, I believe, very, very soon, if not already. The Senate has now embarked on a 3-day weekend. So that is another just insane story. But we start with the congressional testimony. So here is a little bit of a mashup of what we heard from major health officials, including Anthony Fauci and Robert Redfield, head of the CDC, testifying before the House Special Select Committee investigating the Trump administration's response to the coronavirus. So, yeah, they should definitely be investigating said response in a big way because, yeah, it's not been good.
Even though we shut down, even though it created a great deal of difficulty, we really functionally shut down only about 50% in the sense of the totality of the country. But we are cautiously optimistic that this will be successful, because in the early studies in human, the phase 1 study, it clearly showed that individuals who were vaccinated mounted a neutralizing antibody response that was at least comparable and in many respects better than what we see in convalescent serum from individuals who have recovered from COVID-19.
This virus is indiscriminate regarding whom and when it strikes. We continue to learn its characteristics, its behavior, and its effect on Americans across socioeconomic spectrum. We are operating in a highly dynamic environment. We are adapting evidence-based strategies and pushing for innovative solutions to confront this unprecedented public health crisis. I am appealing to all Americans to be part of the public health solution. Wearing a simple mask properly, it's critical to limiting the transmission. Be smart about social distancing and being in crowded spaces. Stay 6 feet apart from others if possible, and be vigilant about hand hygiene. And together, we can turn the tide of this pandemic.
This is just a small part of President Trump's plan to combat the coronavirus. Part of the plan, including...
And Steve Scalise there is the ranking member in this committee, comically holding up kind of like a big stack of papers and saying, look, guys, there's so many papers. He must have done so much work. Like, yeah, that's just kind of just comical there. But let's take a look at what he had to say about that. Just want to because this is a video, but you can't really see all the papers that he's holding up.
Included stopping flights to China, which, as Dr. Fauci testified under oath, saved lives. That was President Trump's call. He got criticized from it.
Much of this.
And again, it's really so funny because, like, they seem to be really, the Republicans, the way they're responding to this, they really seem to be not really focused about the pandemic. Like, they don't really seem to be focused about, if you look at the way that they actually talk to and phrase these questions, like, it's not like, oh, we're trying to ask and get the most amount of information possible from these health professionals, from the top health professionals of the country about what we should be doing, how things are going, and what did we do wrong. It's all about just, like, asking questions and presenting information in a way to make sure that Trump looks good. That is their number one priority in large parts of this point, because, like, it's really incredible. It's just, yeah, it's quite a sight to behold. So here is Jim Clyburn, the chairman of this committee, this subcommittee, about he's going to be talking as well.
It's inconvenience to the public. Nobody feels comfortable getting up every morning looking for a mask. Nobody feels comfortable riding around all day with a mask. It's inconvenient for everybody. So it's uncomfortable for everybody. But the plan must include guidance and support for state and local governments, health departments, schools, and community organizations.
Yeah, so that is him talking about, we don't like to do it, but everybody's got to do it. Yeah, so he did say, just to give you some more information about the vaccine, that was kind of a general look
you may have just
at
that
what
one
we
patient with
see
the
about the
coronavirus.
vaccine. I apologize for that. So Fauci spoke at a hearing on the House Select Subcommittee on Coronavirus Crisis, a panel created by Speaker Nancy Pelosi to oversee the Trump administration's coronavirus response, which is probably long overdue, and we'll get into why it's such a big problem in our next two stories. He said that more than 250,000 people have expressed interest in registering for coronavirus vaccine clinical trials and urged the public to sign up at coronaviruspreventionnetwork.org. His comments came as the French drug maker Sanofi announced that it had secured an agreement of up to $2.1 billion to supply the United States government with 100 million doses of its experimental coronavirus vaccine, the largest such deal announced to date. The arrangement brings Trump's administration investment in the coronavirus vaccine projects to more than $8 billion. This sprawling multi-agency effort is called Operation Warp Speed and is placing bets on multiple vaccines, and one vaccine candidate is already in third and final phase of clinical trials, says Dr. Fauci. So, that is kind of a show, and really is what leading Dr. Fauci to say what is our title here in this broadcast, that a vaccine should be ready by early 2021. Fauci also cast doubt on a study touted by Trump and conservatives conducted by the Henry Ford Hospital in Detroit that showed an apparent benefit for hydroxychloroquine, the anti-malaria drug that President Trump has touted as a COVID-19 treatment. That study is a flawed study, says Fauci. Dr. Fauci was also joined by Admiral Brett P. Giroir, the Assistant Secretary for Health, and Dr. Robert Redfield, the Director of the Centers for Disease Control and Prevention, who told lawmakers he was not directly involved in the final decision to strip his own agency of authority to collect coronavirus data from hospitals, who now must report it to a central database in Washington. So that is, of course, making people a lot nervous because people are going to try to fudge it. Or like, we should be able to, what is the reason? What is the reason why? What is the push? What is the incentive to hide information from or make it less accessible to the public when it comes to information about coronavirus? There's one of those really head-scratching moves, to say the least, that the Trump administration has done during this crisis. Some of the House's fiercest members are on the panel, including Representative Jim Jordan, Ohio Republican, who's been a regular skeptic of Fauci and public health mandates, including mask wearing. Fauci and Jordan had a testy exchange where Jordan pushed Fauci to say that the protests should be limited or shut down over coronavirus concerns in crowds. I'm not going to opine on limiting anything, Fauci said, adding, I don't judge one crowd versus another crowd. So he really is, again, trying his best to stay out of the political game, even though things are just like, they're not going to be, Jordan's going to do his best to put it in the political sphere of things. And honestly, obviously Fauci has had some mistakes, what could be argued as mistakes in rhetoric. I mean, I think him saying, that masks very, very early in the pandemic, like you shouldn't buy a mask early in the pandemic because I guess he could say it would be like the healthcare workers needed because there was a real struggle to get masks, to get PPE. But yeah, him hesitating on that was definitely not good. But I think that's also like explainable. Like he needed to, and the healthcare workers needed it first, and then humans, regular civilians needed it. Healthcare workers needed it more at that time, and that could be a reason for that rhetoric. But all in all, though, I think Fauci has done a relatively good job of staying out of the political and not really looked like an idiot in putting his foot in his mouth. And a lot of other people, even people that are also been like admired by Democrats, supposedly on the kind of Democratic side of things, they have not come out as good. In 14 days, United States cases are down 1% and deaths are up 57%. Cases are rising fastest in Hawaii, Puerto Rico, Missouri, Alaska, Rhode Island, New Jersey, Mississippi, Oklahoma, South Dakota, Kentucky, and Massachusetts. So, yeah, that is kind of what we see at the moment, and we are getting a good sense of the numbers here. Meanwhile, House Democrats on this panel wasted little time in pointing out the caseload is much lower in Europe and Asia than the United States. Clyburn, the number 3 House Democrat on the subcommittee, displayed, and chairman of the subcommittee, displayed a chart showing the disparity. Pressed to explain, Fauci said countries in those parts of the world were more aggressive about shutting down as the pandemic raged. When they shut down to the tune of 95%, getting their baseline down to tens or hundreds of cases a day. By contrast, he said only about 50%, as you heard there in that clip from before, of the United States shut down, and the baseline of daily cases was much higher, as many as 20,000 new cases a day, even at its lowest. More recently, the U.S. has recorded as many as 70,000 new cases a day. Representative Jamie Raskin, Democrat of Maryland, suggested the lack of social cohesion and political leadership was to blame. To that, Fauci said, I think there is such a diversity of response in this country from different states. We did not have a unified response bringing everything down. Trump, who is obviously watching, fired back on Twitter saying, quote, somebody please tell Congressman Clyburn, who doesn't have a clue, that the chart he put up indicating more cases for the U.S. than Europe is because we do much more testing than any other country in the world. If we had no testing or bad testing, we would show very few cases. Yeah, they do have very few cases. They do have a lot more testing here in the United States. Testing is very high, although there have been occasional lags. But the thing is, the cases greatly outpace the testing, so it can't really truly be attributed to it in terms of increases in testing and increase of cases. Increase of cases much, much bigger, which just shows you it's not just because of the testing. All right, here in other news, the French drug maker Sanofi said on Friday that it had secured an agreement of up to $2.1 billion to supply the U.S. federal government with 100 million doses of its experimental coronavirus vaccine. Largest such deal announced to date. The arrangement with Sanofi and its partner, the British pharmaceutical company GlaxoSmithKline, brings the Trump administration's investment in this coronavirus vaccine projects to, again, up to more than $8 billion. Finally, contract tracing in the U.S. is failing, according to, again, a report from the New York Times. Contact tracing is the cornerstone of the public health arsenal to tamp down this coronavirus pandemic across the world, and it's largely failed in the United States as the virus pervasiveness and major lags in testing have rendered the system almost pointless. In some regions, large parts of the population have refused to participate or cannot even be located, further hampering healthcare workers. In Arizona's most populous region, for example, the virus is so ubiquitous that contact tracers have been unable to reach a fraction of those infected. In Austin, Texas, the story is much of the same. Cities in Florida, another state where cases are surging, have largely given up on tracking cases, even just tracking cases, which is kind of insane. Things are equally dismal in California, and New York City's tracing program workers complain of crippling communication and training problems. We are not doing it to the level or extent it should be done, said Stephen Adler, mayor of Austin, echoing the view of many state leaders. All right, here's another very fun one. The Senate has now decided to depart for a 3-day weekend as unemployment benefits are about to expire for 30 million people. The Republican-controlled U.S. Senate has adjourned for a 3-day weekend as enhanced unemployment payments are officially set to lapse this Friday, guaranteeing that tens of millions of Americans will see their incomes drop 50 to 75%, with another rent payment due in 24 hours. Yeah, that just shows you the insane lack of support that is being given to most Americans here in such a time of crisis by their government. And it doesn't really seem like, again, most people care. Sen's departure followed a long day of jockeying and blame hurling on the floor Thursday that only failed to produce a solution for the nearly 30 million Americans who, for months, have relied on the $600 per week unemployment insurance to boost